Welcome to On the Beat. Today we are joined by doctors from Gastroenterology Associates of Columbus and Starkville. Sitting with me is Dr. Ricky Johnston and also Dr. William Gillespie. And we are talking about something that headlines the news all the time, and it's that time of year for those reminders, colon cancer awareness.
That's right. Yep, starting the year, we wanted to kind of hit colon cancer over the next few topics. So we'll have a series of these talking about colon cancer and some of the colon cancer screening methods. But yeah, colon cancer is pretty common. It's a cancer, any cancer is an abnormal growth of cells that sort of grows uncontrollably. And specifically, this affects the colon, which includes the rectum. Some people kind of confuse that, but the colon is the entire large intestine. The rectum is just a certain part, the last part of the colon, if you will. And so cancer that affects that area and then can spread to other places.
Anywhere in that area. Mm-hmm. And then also, too, is it becoming more common?
In certain age groups?
Yes. I mean, you know, we've been screening for a while now, and it used to be age 50, and the rates in 50 and older have been going down, but the rates in younger people have been going up for reasons we don't entirely understand. So that's why we've lowered the screening age from 50 to 45, just because a lot of younger people are starting to get colon cancer.
And so, speaking of that younger age and increasing number of people, what are the risk factors that?
Some of the ones we commonly talk about are obesity. Well, let me back up. The two biggest risk factors are age and family history. Those are really the two things that affect your risk enough to change how often you have these colonoscopy and how frequently. So the older you get, your risk increases, and then people with a strong family history, particularly in first-degree relatives. Beyond that, smoking, obesity, diabetes, sedentary lifestyle, maybe low-fiber diet. There's probably some other things about diet that we don't fully understand. And to his point about we don't fully understand why younger people are getting colon cancer at higher rates. And it's not, the overall rates are still, it's not astronomical, but they're going up.
Increasing.
And that could be, is it ultra-processed foods? Is it something in the diet that we don't really grasp yet? But I think there's more research to be done.
A lot of different factors to look at. What are the symptoms that somebody should look for?
Well, a lot of times people may not have any symptoms, is one important thing to notice.
Yeah.
But typically you can have abdominal pain, unintentional weight loss, lose like 10 or 15 pounds for no reason, bleeding, blood in the stool, and those are kind of the main ones.
Change in bowel habits.
Yeah,
Some people may notice a narrowing of their stool, like pencil stool or ribbon-like stool.
Okay, so things we can look for. And then just in the time that we've got left, treatable and preventable.
Yes, it can be treatable if it's caught early enough. And even if it's not, I mean, there's definitely some treatments from a cancer treatment standpoint. But the important point is it is preventable by having a colonoscopy and removing colon polyps.
So important to do those things.
Definitely.
And to visit you when people have questions or concerns. And like you said, those tests, even when you don't have symptoms, to follow through with screenings. Right. Okay. And if you want to have any questions for the doctors, the information to reach them is at the bottom of your screen. That's today's On the Beat.